Welcome to my channel. My name is Mariam and I'm a doctor here in Jamaica. Today I'll be talking to you about the full breakdown on CAMC exam, the things I wish I knew before writing the CAMC Part 2 exam. I'll be discussing strategies to guarantee your success in this exam. What is CAMC? CAMC stands for Caribbean Association of Medical Councils. And this exam evaluates the competency of foreign trained physicians seeking to practice in the Caribbean. Stay tuned for more details and don't forget to subscribe for future updates and like this video as well. If you missed CAMC Part 1 video that I made, be sure to check it out for additional insights. I talked extensively about the whole process of application. In this video, I'm going to be talking about the application process, the structure of the exam, frequent exam topics, and strategies to pass. So stay tuned. To kick off your CAMC Part 2 journey, you need to fill out the CAMC 2 form. If you've already submitted your documents when you were applying for CAMC 1, which includes the letter of recommendation, your passport photographs, there is no need for you to resubmit them. All you just need this time is your CAMC Part 2 form. And make sure you fill out an active email because that is the means in which they will use to communicate with you. Stay updated on exam dates. The CAMC Part 2 exam is typically held in March, May, September, and November. Also, keep track of the location and contact information for any updates. Exam structure. CAMC Part 2 is a 2-day affair. Day 1 focuses on multiple choice questions with strong clinical orientation, and it's a computer-based exam. Day 2 features OSCE stations divided into 4 sessions. Each session lasts for 10 minutes, and the subject includes OBGYN, pediatrics, surgery, and medicine. There is morning batch and afternoon batch, different questions for each batch. This is a virtual exam, and everyone taking the exam is invited to a Zoom meeting, and everyone is going to be allocated to their examiner. You have 1 minute to read the instruction. This is what I personally call the golden time because you get to take deep breath. The way you start is important. You want to avoid starting with feeling nervous. So take this moment and relax yourself. This is also good because you get to lay out your approach for this patient. If it's a history station, line up the format the way you want to say it and how you want to say it. I'll talk about the history and the counseling format that worked for me personally later on in this video. I'll be talking about day 1 of the exam. On the first day of the exam, it consists of multiple choice questions. Keep in mind that incorrect answers result in deducted marks, that is, there is negative marking. So it's important to exercise caution when choosing your answers. Prioritize the ones that you're certain of, followed by additional 2 options that you believe might be correct. You don't want to be too careful in selecting few answers because you're losing marks that way. At the same time, you don't want to be too careless in selecting just any answer because you're losing marks that way as well. So the perfect cocktail is to balance caution with confidence. For the multiple choice questions, you can't go back once you click next. That is, you can't go back to the previous question once you click next. So the first question that has the history and investigations, spend ample time on the first question, as subsequent questions often relate back to it. So understand the concepts thoroughly before proceeding. It makes subsequent questions easier. Anticipate the next part of the question. This will further boost your confidence in selecting the right answer. So consider possible diagnosis, types, causes, and symptoms to guide your response. It's important to be time conscious. When you realize that it is getting to the end of the session, mentally wrap up and move on as the exam is tightly structured. Utilize CAMC Telegram group for additional support, past questions and recalls, and practice them. I realized that over the years, these are day one common topics that are frequently asked over and over again. They include herpes, anemia, jaundice, otitis media, fractures, leg ulcers, and hyperthyroidism. It's important to thoroughly understand these topics and be able to solve multiple choice questions on them. I'll be talking about day 2, which includes OSCE over Zoom meeting. It's important to read the instructions carefully. This is where your golden minute comes in. If it's to explain the diagnosis to a patient, it is most likely a counseling station. Basically, it won't be written there, oh, this is counseling station on PEDS. No, they will give you a set of instructions, and if it states explain the diagnosis to the patient, it is a counseling station. And if it says elicit history and management plan, it's a history taking session. And if it's a history session, you would see it there. They would say elicit history for 8 minutes. Then you have 2 minutes to summarize your findings and to answer questions. Another tip for the counseling station is, if it's a counseling station, 10 minutes will be allocated in total. They wouldn't divide it into 8 minutes and then 2 minutes. This is very important because the patient won't come to you saying, doctor, I want you to counsel me on my lower back pain. No, you will still have to bring out the diagnosis from the patient. For instance, the lady I had, she came to me, I had to take a brief history on what was going on with the lower back pain before I started counseling her. So reading instructions is so important. Once you get the presenting complaints, have a list of 3 differentials in your head, and once you're sure it is one for certain, keep on asking questions in relation to that to earn more marks. There is a mark scheme, and I don't know what it is like, but on the mark scheme, there are different points allocated to symptoms or causes of the presenting complaint. So once you're sure of that, keep on asking questions on that to earn more marks. Also, I'll be discussing the format that worked for me later on in this video. But if you're enjoying this video so far, please like, share, and subscribe. Another thing that was a surprise to me was that the patient might actually take long to answer your questions. They might be slow, irritable. So it's important to have a particular format in your head. Know the next question to ask while you're asking this one. For instance, after past medical history, don't wait until the patient finish answering before you think of, oh, it is past surgical history. No, as you're asking past medical history, in your mind you're like, okay, the next question is past surgical history. After that is medication. So I could save my time in that respect because the patients were actually slow and some were actually irritable. It felt like they did not want to be there, and I feel like it is good because people that are feeling unwell might not want to talk too much or might be irritable. So it is realistic. But because we are under timed exam conditions, you don't want that to take away your marks. So you have to make it work out for yourself. It's important that you speak fast, you speak clear, and you project your voice. You're being timed. You don't want to have to repeat yourself because your patient can't understand what you're saying. So it's important to speak clearly and project your voice. Be specific when asking questions. Don't be too open-ended in this exam situation. For example, if you're asking, explain the character of the pain to me, that is going to waste time because the patient would have to think of how it feels, then how to explain it to you. Instead of that, just be like, is it a sharp pain, is it dull, stabbing, or crampy pain? Give them options to choose from. It saves the both of your time. Also, instead of asking how bad is the PV bleed, ask how many pads a day does she use, or is there clots there? This saves time and leads you to the diagnosis. Keep talking to fill your time. Some examiners might appreciate this while others might interrupt you to ask targeted questions. It varies. However, you won't be punished for speaking and using your allocated time. This is a pro tip because it allows you to express what you are confident about and utilize your time effectively. because you may receive questions that requires you to take your time to think before answering. Always aim to appear and speak confidently. This instills belief in the examiner that you possess a strong grasp of the subject matter. Once they perceive you to be somebody that is confident, your marks suddenly increase. And a trick for that is smiling and projecting your voice and maintaining eye contact. Common day-to-day topics include hypertension, diabetes, arthritis, Graves' disease, lower back pain, smoking cessation, seizure, dengue, PV bleed, leg ulcer, meningitis, appendicitis, PV discharge. You can practice for history taking and counseling with this common topic. I'm going to be sharing the history taking and counseling station format that worked for me personally. You can use this to form the one that you would remember on the day of the exam. For counseling format, introduction, you introduce yourself as a doctor and you ask for the patient's name and age. Seek permission to counsel them. Confidentiality. Take a brief history because they won't come telling you, Doc, I need you to counsel me on this. They would come with a presenting complaint. So do a brief history to know what is going on, then counsel them on that. Ask them what they know about the illness, and this is a good time to correct any misconceptions. Define the illness, types or classification, risk factors, and make the risk factors specific to the particular patient. Investigations needed, treatment, both medical and surgical treatment, and if there is also a lifestyle change involved, you can encourage that as well. Complications, support system, both around the family and any social support. Insurance, offer leaflets. Follow-ups, when next would you like to see them, depending on the severity. It's also important to ask if they have any questions. This can guide you to where you're missing or the points that you're not talking about. When they've understood everything, ask them to summarize in their own words. It's important that you're empathetic in your demeanor and the way you talk to the patient. Don't talk too fast, and your goal is to explain in understandable, simple terms to the patient and give them faith and hope. The goal isn't just to show how much you know, but also to make sure that the patient understands you. It is important to find the right balance. I made my examiner and patient laugh because I was funny and entertaining. So it's not only about what you say, but also being charming. Imagine this, the examiner has listened to a lot of students say the same thing all day. It can get boring, so it's good to add your own style and charm to stand out. Making your patient or examiner laugh is a great sign, but don't forget to stick to the topic. History format, introduction, presenting complaint, history of presenting complaint, causes, past medical history, past surgical history, medications, allergies, social history, family history. For special stations like OBGYN, include past OB history and gynae history, the complications during and after pregnancy. Pediatric station now, you should include birth history, immunization, developmental milestones, nutrition. Ask them if they have any questions. This will guide you to know the point that you're missing out. Conclusion. I would like you to conclude with, ideally, I would like to do a physical exam, general and focused, which will lead me to my differentials. Then I would like to do in my investigations to guide me to my definitive diagnosis. This alone is a confident way to end the station. The questions that the examiners might ask you include diagnosis, investigations, treatment plan, including the lifestyle, medical, and surgical approach. I'll be discussing game changer tips that actually helped me a lot. By far the most important one is practicing OSCE with those that are taking the exams or doctors that are already working. This is crucial because regardless of your subject knowledge, OSCE demands rapid diagnosis and precise questioning within a time constraint. It's like rehearsing for a play before the big show. This helps you get a feel for what the real exam would be like, and it teaches you how to handle the pressure so that you won't freeze up when the time comes. Don't forget to bring a good headset with speaker attached to it, especially for day 2, because you would need to listen to instructions and communicate during certain parts of the test. That is when you're talking to the examiner or the actor. So imagine the time is on and you have to repeat yourself, and you don't want it to get messy. Or imagine trying to watch a movie without sound. It just doesn't work. And after preparing for this big exam, just to get fumbled by a headset that is malfunctioning, you want to get that sorted now and early. Arrive early. It is important because it makes you calm and have structured thoughts. When you receive your exam ID and password for the test run, take the time to really understand how the exam works, especially for day 1 of the CAMC Part 2. Once you move on to the next question, you cannot go back and the clock is ticking. It's like being in a game show where once you answer the question, that is it. There is no going back to change your mind. So make sure that you're comfortable with the setup and timing before the real day comes. Please make sure you like this video, comment, subscribe to the channel, and share this with somebody that you feel like would benefit from it.